Good afternoon. My name is Ross Wickham, and I thank you for letting me sit in front of your class today and do a small pharmacy presentation on counting solid dosage forms. Solid dosage form means a pill or a tablet. Our objective today is we're going to talk a little bit about automation for counting pills in the pharmacy. They use a lot of automation. And then we're going to talk about medication that cannot be counted in an automation or a robotic machine. Some drugs cannot be counted that way. They need to be counted manually. So what we're going to do today is we're going to talk a little bit about how to do manual counting. It's one of the easiest first tasks we learn in the pharmacy. And I'm going to demonstrate the proper way to do it. Okay. First of all, let's talk about automation. Most pharmacies today use some sort of automation to count tablets and capsules. They use either robots or pill counting machines that count the tablets in a more fast and efficient way. Pharmacy fills billions and billions of prescriptions every year, so without some kind of automation it would be very difficult to meet the needs of the patients. Now, there are all different kinds of automations, from a machine that counts to little die cut things that you can kind of count on, automated baker cells. Things have changed over the years. There's lots of different ways to count. They're usually directly related to the pharmacy. Some have big monstrous robots that can hold over 200 drugs, and some have just a little thing on the counter that just counts each prescription. So it really depends on the volume of your pharmacy. If you're in a busy pharmacy, you might have a big machine that does a lot of the work for you. If you're in a smaller pharmacy, your machine will be proportionate. And what I have here is what I want to show you is some pictures. These are some different types of counting machines, okay, from small to large. Most retail pharmacies and even hospital pharmacies that count pills and solid dosage forms will use something like this. This is called Kirby Lester. Kirby Lester makes this. This is a KLX. It's a basic machine. What happens is you count pills into the top, and it counts 1, 2, 3, 4, 5, 6, and they go into a tray here, and you take the tray out, and then you pour it into the prescription vial for the patient. This one here is just a little bit fancier version that does a couple other things different. Realize when we're talking about machines here, we're talking about solid dosage forms. You can't really count liquids in these. Just tablets and capsules. Okay. Some of the automation technology, that's how it's evolved over the years. These are what are called baker cells. Now, baker cells are like this, but they have a drum inside, and you punch in a number on a little keypad up here. Like if you wanted 30 pills, you'd press 30 and then press enter, and then the drum rotates with all these pills in it, and there's a little chute. So each time the pill fits into the little slot, it drops one down into a chute here, and it has a little gate. So it counts, you know, it just drums, special effects. Okay? And then what happens when you're done, you take your vial and you hold it right up to those little chutes and lift the gate, and it pours the pills into the vial. It's really kind of a cool thing. The problem with these kind of machines is you have to get a drum with a die cut for that specific drug. So if you stop dispensing that drug, or if a generic becomes available, you have to buy another drum. And those drums cost $200, $300, $400. So, or actually maybe not that much, about $100 each. But if you're always changing that, that could be pretty expensive. This one here is just more kind of a robotic machine. This is also made by Kirby Lester. It's a little bit bigger, does some stuff. I haven't seen many of these this much. This one here, this is like the Cadillac. This is, or we'll say the Mercedes-Benz now. All right. This one here is what's called a Script Pro, and this takes the place of a whole shelf of prescriptions. So what happens, instead of having a shelf with a bunch of bottles on it like you see in a regular pharmacy, they would replace it with this whole automated machine. And what happens is when someone types the prescription in, they'll type the prescription in, and it'll go to the filling station, and the technician at the filling station will just press the prescription to be filled on the machine, and this machine counts it. They have a, have you seen those new Coke machines that they have sometimes where you pick the Coke you want, it's got a little thing that goes, the Coke goes into a little thing and then down and then dispenses? That's the exact same technology, the robotic technology this uses. All these little things, if you can see them here, are little little containers with medication. So the technician's job would be to make sure this thing keeps getting refilled when it gets short. And then what happens is the arm comes, gets it, and just like the baker cell, it counts it out, and then the arm comes here, and you can't see it here, but on this end, it brings out and it dumps them into a vial. The cool part about this one here is this one dumps into a vial and it puts the label on it. So all the technician actually has to do here is put the lid on and verify that it was the right drug and pass it on to the pharmacist. So this is a Script Pro. These are the ones that are used in probably really high volume pharmacies. Okay, so those are the different types of counting machines. No matter where you do your externship, you will probably see some kind of counting machine. Unless you do an externship in a pharmacy where there's maybe, you do 100 prescriptions a day, then you might be hand counting everything. But almost always, at least you'll have something like this. This is the most common thing in retail and for a hospital pharmacy. These little machines here actually cost between $1,200 and $1,800 each. And how do they work? They work by when you count the pills into the machine, it drops it in and it breaks a beam of light. Remember, you used to, if you ever gone into a retail store and you walk in and it goes ding, 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 because there's a little reflector and a light that goes across the doorway. And each time you go in and break the beam, the bell goes off. Well, these machines work the exact same way. If you could look inside the machine, there's a bunch of beams of light, like in a Mission Impossible movie, you know, where they're trying to do the jewelry heist type stuff. And what happens, every time a pill drops in there and breaks the beam, the counter counts 1, counts 2, counts 3, till you get to the number that you want, and then you just stop. Because you pour the flow, you just determine the flow rate by how you're pouring it in. If you go too fast, the machine will beep and you'll need to stop. Or it'll just stop counting you, and then you have to redo it again. Okay, does that make sense? Okay. So those are the automated machines. Now, what I said, and the reason I kind of explained that technology the way this one works, is some medicine can't be counted in these counting machines. Okay, let's take a look at that. Okay, some tablets and capsules cannot be counted or should not be counted in an automated machine. Okay, those ones have to be counted manually. And manually means